You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors who care for people with cancer. The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement. Cancer research discussed in this podcast is ongoing, so the data described here may change as research progresses. In this podcast, Dr. Paul Celano discusses what patients should know when taking medication for cancer treatment, including tips for safely storing the medication, special considerations for oral chemotherapy and opioids, as well as resources to help dispose of unneeded or expired medications. Dr. Celano is Division Head of Medical Oncology at the Sandra and Malcolm Berman Cancer Institute at the Greater Baltimore Medical Center. ASCO would like to thank Dr. Celano for discussing this topic.
Hello, my name is Paul Celano. I'm a medical oncologist at the Greater Baltimore Medical Center in Baltimore, Maryland. Today, I would like to talk about how patients safely handle and dispose of cancer medications. As you know, there are many kinds of chemotherapy. There are strong medicines that are used to kill cancer. Oral chemotherapy has become an increasingly utilized means of treating patients with cancer. Traditionally, chemotherapy has been given as an intravenous infusion in either a hospital inpatient unit or clinic or physician office. But over the past decade or so, the self-administration of oral chemotherapy has increased. This is mainly because of advances in the novel targeted therapies. And in fact, up to 1/3 of all chemotherapy today is given orally, and that list is continuing to grow. So this will be a more common way in which we treat patients with cancer. There's a lot of advantages to using oral chemotherapy. Patients have increased control over their medications, convenience, potentially increases in quality of life, actually more sustained use of medications in terms of not just being given every week or so in the office, but every day. Improved travel costs, healthcare resources, so lots of advantages. Balance out those advantages also. There's also some issues around patient safety that can contribute to medication errors, contamination, unintended exposure to other individuals who shouldn't be getting chemotherapy. I think it's important to understand that chemotherapy, although very useful in the treatment of cancer, has a lot of risks to it. We certainly appreciate that in the IV forms, but also in the oral forms, and it's important that these medicines be properly used. The difference, and I think one of the biggest differences in giving chemotherapy in a hospital or physician office or clinic is that when it's the medications given in the office setting, there's a prescribed dose, regimen, response to treatment, and it's very closely monitored. Whereas the oral medications, although patients are and should be given instruction, they are susceptible to either taking too much medications or not enough medications, so-called non-adherence, not taking enough of it or taking it properly, and also the increased risk of adverse reactions, side effects of the medicines. So when patients are given oral chemotherapy, we always are concerned about incorrect dosing, limited monitoring of them, and the potential for serious side effects, including things that could even result in death related to these medications. So we take it extremely seriously. Not taking the medication properly, either not enough of it or stopping it, is also of concern, and this needs to be properly monitored. We also have concerns about the accidental exposure of oral chemotherapy agents, particularly to other family members. So what do you need to know as a patient with cancer that's receiving chemotherapy? I think the key thing is that patients should get clear instruction as to how they should take their medications, how often, how the dosing should be done, should it be with food or not, what are the side effects or things that you might expect to happen to occur from these medicines, including some of the stuff we see with IV chemotherapy, such as stomach upset, nausea, vomiting, diarrhea, hair loss, skin rash, and low blood counts that could result in infections or needs for transfusions. And I think all patients who are receiving oral chemotherapy should get very explicit instruction and really education. The American Society of Clinical Oncology recommends that all patients receiving chemotherapy, whether it's intravenous or oral, should have very specific instructions about their medications. The basics, like what is the name of the medicine? How do you take it? What if I'm having trouble swallowing these pills? Can they be broken or crushed? When should I take it? Can I take it with other foods? How should it be stored? What are the side effects? How long am I going to be on this medication? So it's a fairly long list of things that patients, and it's very important to have an open communication with your physician or healthcare provider. Sometimes it's a nurse educator or a pharmacist even to help with these medications. There are a bunch of sort of do's and don'ts in terms of oral chemotherapy to ensure that this is being done safely. And I will say this should apply to practically any medication we take, because there's a reason why someone needs a medical license to prescribe a medication, or at least these kinds of medications, because they have all serious consequences. So I think this is even important for any medication. But obviously when you receive the medicine, you should make sure it's labeled properly, that it's the proper name and dosage that you were told, that you understand how to take the medication. Things like understanding how to store the medication properly. Should it be in your just medicine cabinet? Should it be in a refrigerator, although it's not common? What to do if you take too much of the medicine? What happens if the medication's damaged? And also, it's very important to communicate to your physician what other medicines that you're on. Those things are extremely important. It's also important to know not to just leave the medicines out, particularly when they can be accessed by others, particularly children, to store the medication properly. Almost none of these medications should be crushed or broken or chewed. And if there's an issue about taking the medicines, that clearly needs to be discussed. And then also importantly, what should happen if you need to discard the medications. Some issues that come up regarding the chemotherapy, patient on chemotherapy, oral chemotherapy particularly, is what should happen with various body waste issues. Certainly, things like the toilet should be watched closely, that the lid should be closed on flushing. Someone should wear gloves when cleaning things like toilet or areas of urine or stool or vomiting, etc. Bedpan or urinals used, that the person handling that should use gloves. And if a patient has an ostomy, a colostomy, or ureterostomy for urine, that should be handled carefully because the chemotherapy agent can be placed in there. If the medication spilled, left on the floor, etc., then proper gloves and cleanup occur. But it also is important here that you're not, a danger to your family, that as long as you're not sharing bodily fluids, that, hugging in close contact is certainly acceptable. Birth control is an issue, and that is something that should be carefully discussed with your physician. So those are kind of the basics of handling oral chemotherapy. And again, very important, good communication, and just ask lots of questions. When talking about medicines these days, one can never not think about other medications that could be important in patients. And with our patients with cancer, that often they're on opioids. It's probably no news to anyone listening to this that the opioid abuse has become a major epidemic in the United States and throughout the world. And it is important that these medications also be greatly respected. I think it's important to understand that more than 70% of patients using opioid analgesics have gotten them through family or friends on a prescription. It's astounding that although we think about these as people buying them on the street, they certainly do, it's important that many of them, the majority of them, come from our own medicine cabinets. It's very important that these medicines be stored out of reach and out of family members. In fact, some have argued, and I think I could argue this, is that they should be in a locked place because of the great potential for abuse, of great damage that can occur to patients who receive opioids. a sad fact that many prescription medications are abused and really need to be carefully watched and away from people. And this brings us down to what to do with all these medicines. Sometimes as we go through, whether it's the illness and the medication is not necessary anymore, or has become ineffective, or there's side effects related to it, that they're often left with unused medications, or sometimes they'll expire, the date on the medications will expire. And there's often an issue what to do with these medicines, and it's important that these medicines be properly disposed of. You can bring them to your physician's office. Each locality actually has information on to safely dispose of medications, usually through the police departments. They usually have some form of lockbox of some kind that patients can drop these off. Each year, or twice a year, the DEA has announced so-called Take Back Day. And it's really, the initiative is to announce that there is a proper way of disposing medications, and also brings to light a high number of accidental poisonings, overdoses related to prescription medications. If you go to the DEA website, the www.deatakeback.com, it has lots of specific information on drug take-back. A crazy statistic is last fall, the Take-Back Day netted 456 tons of unused or unwanted medications. It's an astounding number, and it's actually grown each year. So every year we're hoping that more people will bring their medications that are unused, and will keep them away from people that don't need them. That's all for today. There's lots of issues around this, and it's very important to be careful with these medications when you're ingesting them, exposure to your family and friends, and to properly protect the medication so that there isn't any abuse and unfortunate damage to people. Thank you very much.
Thank you, Dr. Celano. Learn more about handling your medications at www.cancer.net/safe-storage. If this podcast was useful, please take a minute to subscribe, rate, and review the show on Apple Podcasts or Google Play. Cancer.net is supported by ASCO's Conquer Cancer Foundation, which funds breakthrough research for every type of cancer, helping patients everywhere. To help fund Cancer.net and programs like it, donate at conquer.org/support.